One of the things you said earlier was the combination therapy.
Mm-hmm.
And in oncology, do you see a lot of that combining different therapies to treat certain types of cancer?
Yeah. You know, historically, particularly when we were using traditional chemotherapies in the past, using drugs single agent sort of sequentially led to earlier resistance or perhaps less efficacy. And so combinations sort of became the norm in many cancers over the time from maybe say the 70s to the 80s and 90s. I think now it's much more a question mark, because in some cases we can get drugs that work well as single agents and maybe don't need combination therapy. In some cases we're learning now how to coax the immune system into fighting cancer. And if we can, sometimes that requires one or two levers, and that might not even be chemotherapy, but immunotherapy combinations as well.
Yeah. You know, it's a really exciting time in oncology with, you know, all the visibility. You've got Vice President Joe Biden's Moonshot Initiative bringing people together and collaboration like we've never seen it before. You know, if you look into your crystal ball, what do you see on the horizon, and what really excites you about where oncology therapies are going?
Well, you know, Dave, I think the pace of change at this point has really hit a critical mass. And serving as the medical director of hematology research for U.S. Oncology, I get to see the pace of development across a whole variety of diseases. And we are rapidly approaching, well, in fact, even today, we have a better insight into how these drugs work, why they don't work. And so in the past, we used to just throw a lot of mud at the wall and see what stuck. Whereas now we're making very intelligent clinical trial decisions and choices. And so even things like early phase 1 studies, we could go into a patient population where our expectation in some cases that patient's going to respond tremendously even in an early stage disease, which that was not the case. Look, cancer is not one disease. There's not going to be one cure for them. But perhaps through many of these new immunotherapy techniques or smarter combination chemotherapy, there will be more cures in many, many more diseases. And that's not just in the future, that's actually happening now in some cases.
Good news for patients. Well, doctor, thank you so much for stopping by. I appreciate it. And good luck with your study.
Thank you so much.
Thank you.